Okay, guys. Well, welcome to Fortis online college stuff. For this is medical terminology, the 105 classes, and today we're doing the Mastering Healthcare Terminology 6th edition. Betsy Shyland is the book, and this is week 3. So this is part 4 actually of our where are we at here? Part 4 of our lecture series, the interactive lecture. This is chapter 9. We're jumping straight ahead here into blood, lymphatic, immune system stuff. So blood, we're going to talk about hemoglobin. We're going to talk about erythropoiesis and some other terms you may not have already heard. And we're going to talk about lymphatic system, which is a totally different system. Now, remember we were talking before, like, say, for information, the nervous system is the fast travel system, and the endocrine system is the slower travel system. So it depends on how you're looking at it, really. However, blood system, the cardiovascular system is pretty quick, and the lymphatic system is pretty slow. We'll get into why that is a little bit later. I have done other videos on this. If you subscribe and you look for the playlist, the Anatomy and Physiology playlist, you can look up lymphatic system. That's where I actually drew out some different diagrams of how the lymph system works. It's a little bit better because this has no diagrams in it, which I'm not thrilled with, but it is what it is. Now we'll talk about the immune system, which everybody's been talking about lately. So, I mean, you've been exposed to a lot of new words. Lesson 9.1, this is Anatomy and Physiology of the Blood, Lymphatic, and Immune Systems. We're on slide 14. So you should be able to see, I don't think you can see that, but I'm on slide 14. This is page 3, which you'll see come up above my head, right there. Okay. So as we go through this, you can follow along in your own stuff if you want to, or take notes, whichever. Anatomy, Physiology of the Blood, Lymphatic, and Immune System. The idea here is to recognize and use the terms related to the lymphatic, the anatomy and physiology of blood and immune systems and stuff like that. So it's kind of like the main basic entryways to all of this kind of stuff. We have 42 slides to go through here. We're already at about 15, so that's pretty good. Functions of the blood and blood specialty tests. So blood has a good function. It's to carry oxygen, right? So here we see the functions of blood itself. Transportation of what? Transportation of nutrients, transportation of oxygen, transportation of carbon dioxide, and also wastes. Okay. Regulation is talking about regulation. A regulation can be from uh, pH regulation, which it can have a role in, which is, remember, the potential of hydrogen, how much acid or base you have in your blood, as the blood is listed as basic or acidic. Protection from infection, well, that's the immune system itself, right? Protection from blood loss. Well, how does blood protect from blood loss? That has to do with platelets and scabs and things like that, and clots. Okay, which clots are a good thing unless they jump away and become bad things. We'll talk about that too. Specialties would be a hematologist, or a specialty would be hematology, one who studies blood. Whenever you see hema, that's going to mean blood, okay? So we go through here. Functions of the lymphatic system. Functions, the lymphatic system. So the lymph system is a one-way system. We'll talk a little bit more, but again, go back to that other video I did if you want to learn more. It's one of the least understood systems we have. It's also the least kind of cared for. People don't even know what to do with it, and even many healthcare providers are like, I don't know, it's lymph, it just does what it does. It's a very slow moving. It always moves in one direction. That's from the extremities, like from the toes or the fingers, all the way back to the center, up in this area in the chest. And then eventually it goes through the circulatory system as well. Um, it has a lot to do. Think of it as like a special roadway just for the garbage trucks and the cleanup crews of the world. Okay, so it helps you clean stuff up and get rid of things that you don't want in the other system. Returning, that's what I mean by returning. Providing a pathway, they're providing a pathway, right? And defending, how the hell does it defend? Well, it defends by having lymphocytes, which are blood cells, white blood cells, in areas that you want to protect. So you protect like gateways. So everywhere that you have basically a major bend, like in the elbow and the armpit and the neck, you're going to find what are called lymph nodes. And sometimes you've had people reach in here and feel like this, and I feel like something feels like about the size of a bean. Like, what the hell is this? Oh my gosh, I'm sick. If you feel them bilaterally, it usually means you have some kind of infection that you're fighting. You can have them unilaterally, if you will. So let's say you cut your finger and you have an infection starting here, you may get increased lymphocytes or lymphocyte action coming down there to fix that, and that would cause the swelling of the um, lymph nodes. Okay, function of the immune system, and especially function defending, of course, right? It defends and also monitors. There's a lot of monitoring that goes on with the immune system, and we'll talk about that. And it's really a good system to not only coordinate ourselves to the outside world, but also to be a microcosm of that outside world, which means a small little world in the big world. Okay, immunologists study immunology. You should know that one. That's an easy one, right? The hematic system. Okay, so hematic, I'm not sure if uh, hemo is usually the term that we use, but hematic system is blood vessels. So hematopoiesis, it means to develop and make blood. It happens in the red bone marrow, which we talked about in the skeletal system, right? So blood composition, the blood in general, your blood, if we pour your blood out or a drop of blood comes out, the red stuff, right? There's going to be erythrocytes. Erythrocytes mean red blood cells, right? And then leukocytes mean white blood cells. And then thrombocytes are those that help you with clotting and with repair. Okay, and then you have this other stuff called plasma. Remember, we talked about cells. We had a thing called a matrix. The matrix is where all the other stuff hangs out. That's what plasma is. Plasma is the matrix for blood. Plasma is the liquid portion of blood. All the other stuff all together make it a what kind of tissue? Do you remember? Remember the types of tissues? We had epithelial tissue is a covering. It's not a covering. There's connective tissue, which holds and binds and protects. Yeah, that's one. And then we had nervous tissue and we had muscular tissue, right? So we had those four different tissues. And so blood sits in connective tissue. Components of blood. This is erythrocytes, red blood cells have hemoglobin. Now they're not typical cells where they're not round like this. Imagine them flattened. So they have it's like flattened like a donut, really thin in the middle. So it's like a little round thing with a flattened area. It has no nucleus, so it can't repair itself. Remember, the nucleus has the DNA, and what it does is has the ability to make new proteins to repair itself. The red blood cells don't have that. They gave that up to be able to, like here we have erythropoietin. Okay, is a hormone that's released by the kidneys. Okay, to stimulate the red blood cell production in the red bone marrow in the large bones. Remember, we talked about that. Which part of the bone? Remember the epiphysis and the diaphysis, the long bone. I don't have a bone here, but imagine this was a bone. This is the epiphysis, this is the epiphysis, and this is the diaphysis. It happens in the epiphyseal areas, and there's that spongy bone that would happen. Hemosiderin in this case has to do with the ability to hold iron. Okay, and then hemolysis is the death. It breaks apart, and there's a lot of reasons that a blood cell will lyse or break apart, and it could do with it's eventually it ages enough, like 120 to 180 days, it flies around your system after it's born, and it gets all beat up because it can't repair itself. There's no repair system, so it gets reabsorbed in two places. One called the spleen, which is in your upper left quadrant. Okay, remember that? Remember the quadrants. Remember we had this guy. We had our little quadrants here. Here's his little belly button, and then we have the upper left and the upper right and the lower right and the lower left. So it's in the upper left quadrant is the spleen, and the upper right quadrant is the liver. And the liver also reabsorbs some of those. That's why you can live without a spleen. Okay, morphology is the structure. How is it morphed into, right? Like Mighty Morphin Power Rangers, they morph into something else. Components of blood. Okay, we have also in there this continuing leukocytes, which are white blood cells. So we have different kinds when we look at them under the microscope. That's the only place you're going to see them this way. You're going to see granulocytes, which means like cells with grainy bits in them, or agranulocytes, cells without grainy bits in them. So when you're looking at them, and we don't have any pictures in here, which is, because you don't have a traditional lab like I had back in the day, we had actual, like, you take a drop of your own blood and you put it on a slide, or you'd get slides provided for you, and you'd be able to look at like some of these different cells. Agranulocytes means has no grains in it when you look at it under a microscope. That's it. So the granulocytes or polymorphonucleocytes. So polymorph. So many shaped, basically, nucleuses. So some of them will have lobed nuclei in them. So we have eosinophils, neutrophils, and basophils. Each one of these have different functions. For example, like eosinophils can help with allergies and also with foreign invaders. don't know if you guys ever remember, some of you might not be old enough. Back in the day, Michael Jackson did a thing called Captain EO. When Captain EO was a show that you would see at Disneyland. And in that, he was always fighting these alien invaders. So Captain EO, it made sense, right? See, I learned something from that. Anyway, components of blood again, agranulocytes. These are mononuclear. They have one nucleus or one confined nucleus. It's not in little lobes. There's monocytes, which means single cells, and then lymphocytes, which means, part of the lymph system. That's where we find most of them. Thrombocytes and platelets in this one deal with coagulation. So we have now eosinophils, basophils, and what was the other one we had? There's three of them there. Basophils and neutrophils. So B-E-N, basophils, eosinophils, and neutrophils are the granulocytes. Ben has grains. I don't know, I'm making this up, man. Agranulocytes, monocytes, and lymphocytes, and then we have thrombocytes and platelets. This has to do with clotting. So we talk about coagulation, when blood clots. So if you cut yourself, in about a minute or so, you'll bleed, and then it'll become thickened. And that's this part here, agglutination. You have what's called thrombokinase. Kinase, when you see kina or kine, K-I-N, it means action, like activity. You have like kinetic energy is action energy, right? Then we have prothrombin turns into thrombin, and then fibrinogen. So here's another interesting thing about the word fibrin. So fibrin means fibers, right? You have little like lacy stuff like a net. Fibrinogen is a chemical that helps you to make fibrin. Gen is the key part of that. It means like to generate, or genesis, for example, the beginning of things. And then hemostasis means the blood stops. Now you have those little, I don't have them here, but they look like a little pair of scissors, right? But they have little clamps on the end. Those are called hemostats. So you use those to stop bleeding, right? So you'd have like an artery or something that's ruptured for some reason, and you would use one of those to clamp it off. You're doing surgery and you have to move some stuff around. You clamp things off, and then you can cut the middle of it and get it out of there. You guys might be dealing with that. I can't deal with those kind of things. It's gross. Anyway, components of blood. Again, slide 5 of 5. Plasma. Plasma is the fluid portion. It's oily. It's straw colored generally. Serum equals plasma minus clotting proteins. Okay, serology is the actual what's it called? Term for those who study that kind of stuff. Now you can donate serum by itself or plasma all by itself, and it's worth more because they can use that as a base for a lot of things. Blood groups, you have blood types. You have A, B, and O. O is the universal donor, can donate to anybody. AB is the universal receiver. Okay, and it has to do with the antigens and the antibodies on them. So for this class, get antigens and agglutinogens. Wow, agglutins and antibodies all together. Make sure you have those. Universal donor, we're talking about O. Universal recipient, AB. And then RH factor has to do with rhesus monkeys. That's where it was originally discovered. So RH factor, if you're positive or negative, it depends on whether the mother's body, when a baby is being gestated, has the same RH factor. If they don't, there can be a problem with it later on. But we now have all kinds of, I can't remember the name of the drug off the top of my head, but there's a kind of shot I think they give you, and it basically negates that, and you're all safe. So it's amazing there's that many people on the earth, right? They used to have blood tests back in the day. They'd give you a blood test and see if your RH factor was good, and you had to have that to get a marriage license or something like that. I seem to remember that back in the 70s, a long time ago. Lymph and interstitial fluid. So plasma is the fluid portion of blood. When it leaves and I do this in my explanation of the lymphatic system, which you guys can watch. I'll try and put it in here somewhere in the YouTube thing, but I usually forget how to do that stuff. So look for a lymphatic system, and I'll draw it out. So when the plasma leaves the blood vessels and it goes in between the vessel and where a cell is, that's interstitial fluid, right? And then it goes intercellular fluid, and then it comes back and it becomes eventually lymph. It's all the same fluid, has a little bit different consistency, or basically minerals, which are the electrolytes. Okay, so your calcium, magnesium, and stuff like that. And that gives it some osmotic pressure, which is the ability to move fluids, right? That's osmosis. Lymph vessels, okay, lymph angiogram. You could do a lymph angio. Plasty, you can repair them, all that kind of stuff. Angio means vessel, okay? Lymph nodes, lymphadeno, so denectomy, for example, and lymph organs. Lymph organs basically are going to be the thymus, the spleen, and the lymph nodes, okay? So we go through here. The role of this one here, we're looking at how much time are we in already? Uh, oh, 15 minutes and we're already on. Oh, so we're doing really good. Role of cytokines. What's a cytokine? A cytokine is actually a kind of chemical that helps the cells move, the white blood cells get to an area. So it's an alarm system. We've heard a lot about a cytokine storm, okay? Which means that like all the alarms go off, everybody comes freaking out running, and it can cause problems in the body, especially with this COVID thing that's been going on. Levels of defense, we have a first line, which is non-specific. Now that's going to be like your skin, your mucous membranes, which is inside your nose and your mouth, etc. And the second line of the defense is some of your white blood cells and some of your other immune factors that you have. And then the third line is more specific immunity. And that's going to be your T cells and your B cells and guys like that, which we've heard of, but we'll maybe learn a little bit more about those in here. Remember, we're looking more in this one on the terminology, how to understand how it all connects, really, right? And how it works, so with anatomy and physiology. First time line of defense is non-specific. We have mechanical, that's your skin, okay, which have the keratin and all that jazz that we talked about. Physical, so like being able to close your mouth, I suppose, I guess. And then chemical, which is like you have specific pH levels, like in the eye, or lysozymes in the tears that help clean the eye. Okay, second line of defense, phagocytosis, which is phago means to eat, okay, and pinocytosis means to drink. So you have cells that can eat stuff and cells that can drink stuff, basically. Inflammation, I don't know if I told you guys, but inflammation has 4 parts. Those are Latin words, and it's going to be, first one is you're going to have pain. That's a hallmark of it, which is dolor. That's the Latin for pain. We're going to have redness, which is rubor. We're going to have heat in that area, which is calor. And we have edema, which is swelling. So if we poke ourselves with a needle or something, we're going to have all of those things. That's inflammation. Okay, so you have early inflammation, late inflammation, and all that kind of stuff. You have protective proteins, which are called interferons, and they do just like it sounds. They interfere on something. So they interfere in the reproduction or the creation of bad guys. That's what they do, viruses and stuff like that. Now you have complement proteins, which will are either kind of like, let's think of complement proteins as either like you're playing a video game and you come across a cache of ammunition and new weapons. That's a complement protein. Or the weapon, right, for the big boss battle. That's what helps with those kind of things. Natural killer cells just run around and check things out, and if things aren't good, they destroy them. Basically, it's like security. They walk around, they check everybody's ID. If your ID does not say that you belong where you're at, they get rid of you, or they at least give you a ticket or something. I don't know. The third line of defense, now here's where that also bounces in. Let's say that security guard sees this ID and says, oh, you're not supposed to be here. So let me take a picture of your ID and I'm going to put it up in the office. And now your picture's up there in the office. And when anybody sees you come to the front desk, they don't let you in. That's the third line specific immunity. Don't let this guy in. Okay. Body's identification of pathogen and antigen, same thing, right? So usually it will understand or remember that there's, for example, spike proteins. It'll go after something with spike proteins and be more aggressive towards it. Antibodies and immunoglobulins are formed later on. Once it recognizes that, it says, okay, let's have people who are looking specifically for these. So let's print out some new pages with the picture of the bad guy. Processes may be genetic or acquired. So you can have, so it's really funny. We have natural or artificial, passive or active. This is where we get into things like vaccines. Now, generally, when you've had a disease process and you survived and your body goes like, hey, I know what that is. I can get it. I'll get rid of it next time it shows up. It'll do that. That's called your active immunity. The passive one is where you give a dead thing, like a virus that's been killed, into the bloodstream, and the bloodstream goes like, whoa, this is what the bad guys would look like. So you show up with like a goblin, and they say, this is what a goblin looks like. See, this is how big they are. If you see one, kill it. Okay, there we go. Pathology. So pathology of blood means the bad things that can happen in blood. A lot of bad things can happen in blood. Lymphatic and immune system, recognize use terms. So anemia. So anemia means you're losing, okay, is less than. You're losing something. So Chronic blood loss can happen. Let's say you have an internal bleed, or you have a hole in your stomach or something like that, and it's slowly bleeding out, or you have some chronic blood loss. Sort to be pernicious anemia. Pernicious anemia is everything and everything missing, and cytopenia has to do with B12 actually, and then chronic blood loss, post hemorrhagic anemia. Well, okay, so acute post you get in a car accident or something and you lose a lot of blood, or you get stabbed or something, you lose a lot of blood. That's acute post hemorrhagic anemia. Now your body should start the hematopoietic system again and get some more blood flow, blood cells built over time. Okay, but we have to be careful of things like chronic blood loss, B12 deficiency, and folate deficiency, and hypovolemia. Hypovolemia means low volume of blood overall. Folate is a these are B12 and folate are both vitamins. They're considered vitamins or nutritional things. B12 is one of the B vitamins, of course. It has to do with blood repair. Um, Aplastic anemia, autoimmune, hemolytic anemia, non-autoimmune, acquired hemolytic anemia, pancytopenia, thalassemia, and sickle cell anemia. So of all these, I mean, you have many different kinds of aplastic anemias. These can be either due to chemical exposures, they can be to genetics, they can be due to um, other disease processes like cancers and autoimmune things, of course. If we're looking at sickle cell anemia, it's a very interesting one because it is actually a way the body was trying to uh, evolve in a positive way. So in the areas where people would get sickle cell anemia, which is that Central African area, that there was a lot of malaria historically. And one of the things that happens is the malaria cannot affect those people that have sickle cell anemia. However, people who have sickle cell anemia have all kinds of other things. They get like a lot of pain syndromes and poor oxygen movement and stuff like that. Workable with blood transfusions and things like that these days, but I know that they're working feverishly on getting some of those things mended for people because that's a bad deal. You don't want to have that. A lot of people have different levels of it as well. Hemophilia, usually, so this was a really big one back when I was a kid. Hemophilia was, you were called a bleeder. And so you didn't have, mostly happens in males on that one. And you don't have the ability to clot like you should. Polycythemia vera, purpura. Purpura is like a little tiny, bruise. That's what they look like. And thrombocytopenia is you have low thrombocytes. Okay, which means you would bleed more as you get bruised easier, okay? Terms related to systemic infections, septicemia, septic, like septic tank, right? Septicemia has to do with a bacterial infection that you get in your blood. It can be fatal. Septic shock is what you go into after your body starts to collapse with that. And then systemic inflammatory responses, a SIRS. So this one, they used to have pelvic PID, pelvic inflammatory disease. They still do. But one of the things that happened was early on when IUDs were being developed and used, they would have a little string that would come out through the cervix, and bacteria would go in there and cause pelvic inflammatory disease. And that could lead to septicemia and septic shock and then death. So they had to retool a lot of those kind of materials that they use. Systems related are terms related to leukocytic disorders, leukocytosis, eosinophilia, white blood cell condition is what that means. And leukopenia is low white blood cells. Okay, so here's the different terms. Eosinophilia. So philia means it loves more, it wants more, right? So philic wants more. Lymphocytosis is a condition of, again, monocytosis. Eosinopenia, neutropenia, lymphocytopenia, monocytopenia. Okay. Now you can look up more detailed ones of those at a later time. I just want you to know the words and kind of like what they really mean. Okay, terms related to lymph disorders, lymphedema, edema, hypersplenism. Hypersplenism. That's a terrible term. I don't like that term. Hypersplenic, maybe. Mononucleosis. Mononucleosis used to be called a kissing disease. It's a virus. Okay, Epstein-Barr virus is one that really causes a lot of fatigue issues, and splenomegaly is a big spleen. Okay, lymphadenitis. Okay, adenopathy is a problem with them. So adenitis is lymph node swelling. Lymphadenopathy is lymph node swelling and problems. Angiitis is pain. Okay, lymphocytopenia is decrease in the cells, and then lymphocytosis is increase in the cells, so you have more lymphocytes in your system. AIDS, acute. So that's what AIDS means, right? Acquired immunodeficiency syndrome. It's a syndrome. It can happen with other things other than HIV, which is human immunovirus. Now, it can happen with other things. You can get it from cancer, you can get it from chemotherapy, you can get it from lots of different things. Radiation exposure, for example, can kill off your immune system, and you would have acquired an immunodeficiency, right? It's a syndrome. So syndrome isn't very specific. It has a collection of things that kind of we ball up into one thing. Allergy and hypersensitivities, you have an allergen like cat hair or something. You have anaphylaxis, which is the reaction to it, and the immediate reaction versus delayed reaction. So some of us can have like stuffy nose or coughing or even anaphylactic shock. Autoimmune diseases, autoimmune diseases is where your body's really attacking itself. So you can have like rheumatoid arthritis, lupus, SLE, systemic lupus erythematosus, and stuff like that. There's many others, of course. Usually like, um, what is it? Not eczema. It's one of those. The skin conditions are very common that way. Terms related to benign. Benign means it's okay. Neoplasms is new growth. So a benign, a not bad new growth would be a thymoma, which is the thymus gland, which is right beneath this bone here. It's relatively large in a baby and it gets smaller as you get older. So it's only a little wisp by the time you're an adult. It has to do with T cells, actually, the maturation of T cells. Terms related to malignant, these are the bad guys. Acute lymphocytic leukemia. So here, oh, these are good. So myelogenous acute leukemia, chronic lymphocytic leukemia, chronic myelogenous. So remember, myelo means bone marrow, right? It kind of means the marrow. So these are from the marrow, and then the lymphocytic has to do with the cells themselves. Malignant neoplasms, Hodgkin's, non-Hodgkin, multiple myeloma, malignant thymoma. I don't know how many people get that malignant thymoma. I would assume very few. Multiple myeloma is very common. Hodgkin's and non-Hodgkin's are also rather common. Happens in the lymph system. So sometimes in the lymph system, in the center of the body, deeper inside as well, is where you can get those tumors. Pediatric, age matters. What? Hypersensitivities, hypovolemia, non-Hodgkin lymphoma, acute lymphocytic leukemia, acute myelogenous leukemia. So these are the different ages. Generally, younger people will get the hypersensitivities and hemolytic disease of the newborns. Well, because they're newborn, right? Old people don't get newborn diseases. And then geriatric is older people. Hypovolemia, they just slow bleeds and stuff like that, or maybe their spleen is going crazy and just eating up all their blood. Lymphomas and stuff like that. As we go past here, diagnostic procedures and therapeutic interventions of the blood. Lymphatic and immune system recognize use terms. Okay. Lymph adenography. So we're going to look at the lymph nodes, right? Lymph angiography. So we're going to look at the lymph vessels. Splenic arteriograph. Uh, Splenic arteriography. You're going to look at the arteries that go to the spleen. Remember, arteries go to things, and veins go back to the heart. Okay. Terms related to laboratory tests, they have AIDS tests, ELISA, Western blot, allergy testing, blood cultures. CBC is a complete blood count. You guys will hear that one. That's a good one. Complete comprehensive metabolic panel. That has to do with usually a fasting glucose, which you have to not eat for 12 hours before you take it. Coombs antiglobulin test. Terms related to laboratory tests, differential count. What are the different kinds of cells you have in there? ESR, erythrocyte sedimentation rate, hematocrit. So you have hematocrit and hemoglobin. Those are two different things we like to measure. Mean corpuscular hemoglobin is per blood cell, okay? And concentration, hemoglobin concentration. Okay, so MCHC. These are typical terms for complete blood count blood tests. Monospot, prothrombin time. Prothrombin time has to do with your ability to clot. Okay, Schilling test is also has to do with clotting actually. Schilling test is, I can't remember right off the top of my head. White blood cell count, 1 WBC, Schilling test. I'd have to look at it. I think it's still clotting. Terms related to blood disorder interventions, apheresis, leukapheresis, Plasmapheresis, plateletpheresis, blood transfusion. Okay, so you either take them out or you put them back. Bone marrow, autologous or homologous. Okay, bone marrow transplant. So you see a lot of these, they'll do blood drives. They want to see people who have very specific markers in their genetics to be able to give those kinds of tissues to others. So I remember in Southern California, we had a large group that did that for the Asian American because Asians have a very specific type that they need from other people. And so it's very hard to get those. So they would do drives to get people to try and get on a register so they could donate some bone marrow. Lymph biopsies, lymphadenectomy. You have the lymph nodes taken out. It happens very common in breast surgeries, okay, or breast cancer surgeries or mastectomies, okay. And a splenectomy, you get an infection and the spleen gets too inflamed and damaged. They have to take it out. Pharmacology, anticoagulants. Anticoagulants could be things like aspirin is an anticoagulant, warfarin is an anticoagulant. Keeps the blood from clumping together. So if you want to keep from getting like a stroke, because if blood clumps together somewhere in your body, then it becomes a thrombus. Thrombus is what it is. And so we have deep vein thrombus, for example. If those break loose, they become an embolism, an embolus. Okay, and they fly around and they can end up in your brain or your heart or your lung, and you can die. Blood flow modifiers, colony stimulating factors, erythropoietic agents. Erythropoietic agents are those that help you build more blood cells. Pharmacology and circulatory, hemolytics, hematopoietic, hemostatics, ones that stop your blood, hemostatics. Thrombopoietic, so that help your thrombocytes. Okay. Pharmacology, antihistamines, goes against histamines. Histamines is a natural reaction to an invader or to an injury. You have a histamine, that's the inflammation process, right? Remember those? We had the pain, the swelling, the redness, and the heat. And that'll attract the cytokines, or the cytokines will be activated, and it'll attract white blood cells and repair guys to the area to fix it up. Anti-IgE agents, anti-neoplastics, anti-neoplasm. So neoplasm has to do with cancer and anti-cancer stuff. Antiretrovirals. Okay, oops, retrovirals works against your viruses, actually. Okay, corticosteroids and cytotoxic agents. Cytotoxic means it takes out some of the things that they can do bad, or helps them be bad, like that would be like chemotherapy. Immunosuppressants, leukotriene receptor antagonists, protease inhibitors, and vaccines. Okay, so that's the last part of this chapter. If we go back to the beginning here, just so you can see, Mastering Healthcare Terminology, 6th edition, Betsy Shilen, chapter 9. So this is week 3, part 4 of the whole class. So I'm just gonna go right ahead into everything, and we're gonna end it here. I'm gonna go straight to the next chapter, and we'll do that one so you can watch that one too. And don't forget to do your homework when you're doing your discussion boards. Answer to people and answer them in complete sentences. Don't say things like "I agree," because you can say that to anybody, and we need things that aren't generic. So don't do generic stuff. Do something specific. I don't know. I mean, thrill me, man, or something, because it's I have to read a lot of them. So it's better to have more of that conversation. So pick one of the words in the discussion that you saw from the other person and say like, this means this, and that's interesting because XYZ, whatever, something like that. Okay. Don't forget your quizzes and your stuff like that. Most of your quizzes have 2 attempts, so let me know if you need to update any of that kind of stuff, or if you're having any trouble. This is Dr. Sean over at Fortis College. Take care. Goodbye and good luck and whatever.